You won't be seeing me after this, don't get. Another thing is when you are thinking of CNVMs, the mistake we make, like pachychoroid, is a patient of choroiditis. For example, this lady, now she's a very young girl and she says, now I am symptomatic and I'm having metamorphopsia. So, you look at it and you say, oh, everything is scarred, nothing much happening. And I first thought probably there was some extension of the scars into the fovea, and that was the reason for her recent symptoms. You do OCT, and she had received treatment for TB choroiditis earlier and steroids also, but you see something like this, which is called Schramm, or even if we don't call it Schramm, there is some hyperreflectivity going on, and you are not sure, is it the scarring of choroiditis, or is there something happening underlying? You do all sort of investigations, but it's, there is so much happening in a choroiditis eye that it is very difficult to pick up an underlying new vascular network. And here is the OCT angio, which shows a beautiful underlying new vascular network under this. Now, the question which was being discussed before I came here between Jay and Raja was, how would you follow these patients? To me, the symptoms are the most important. If this network was there and my patient was not complaining and her vision was stable, I would just not go on injecting because it is present. But the day patient complains of something will be the day when I would inject if there is no fluid on OCT and you are looking at these new vessels only on angio-OCT. We are in the process of characterizing the active from inactive, but for all clinical purposes, we have not yet reached the stage where we can see that we are seeing the new vessels, so just inject. This is how it was. We realized if we were injecting, the vessels were going better, there was pruning, and if we would extend the interval, the vessels would kind of come back. So this girl we have almost for 2 years now follow-up, and it is PRN basis. So I think the moral of the story for this mistake is that sometimes you have a choroidal new vascular membrane which may be complicating an underlying disease. Jay showed you a patient of choroiditis, patient of pachychoroid. I have shown you patient of choroiditis, and there are a lot of publications, including from Dr. Rima Bansal from us, chronic CSC. Chronic CSC, now with the angio-OCT, we are seeing a lot of new vessels which are lurking beneath, which will respond to anti-VEGF. If you are seeing choroiditis and new vessels, it will respond to anti-VEGF. But if you are seeing pachychoroid and new vasculopathy, it will respond to PDT. So that is why it is important to know what is happening underneath.
Thank you, ma'am. Now